So let's get started with what is trigger finger. Good morning, everybody. As you may or may not know, my name is Eric Christensen. I am the owner and lead physical therapist with Chandler Physical Therapy here in the great state of Arizona, Chandler, Arizona. And today I want to talk all about trigger finger because that is something that surprisingly a lot of my patients don't know that we treat. And I think the general theme is that, if I have trigger finger, either number one, I'm going to deal with it and just kind of make my life do what it's going to do, or number two, I'm going to try and go to a surgeon and get it surgically repaired, which for some cases might be appropriate. For the vast majority of people, you do not need surgery. You do not need any sort of injection. It can be managed with physical therapy conservatively without any sort of medication or anything like that. So that's my goal for talking today. Um, Trigger finger is something we see. I probably have one or two patients on my schedule at any given time with trigger finger. And what it is the tendons of the hand, either because of overuse or some sort of injury, and especially today's society where we manipulate either keyboard or something with our hands a lot, overuse is very, very common. But because of overuse, we see the flexor tendons most commonly get overused. And there's a tendon, let me just share the screen real quick. It might actually be a little bit easier to do. Let's see how we do here. All right. So let me hide this as well so you can actually see something. And so with the hand tendon, we'll zoom in just a little bit. Hopefully it's not too grainy. You have the tendons of the finger that go to the flexor side that kind of make a fist for you. But they're encapsulated by a sheath. And actually, this is a very simplistic drawing. You have different ligaments and tendons kind of running all over across these to keep them close to the bone so they don't just fly up kind of like a bow and arrow if you were to bend your finger. What happens is that some sort of irritation happens to the tendon and it becomes thick. And much like a blister will turn into a callus over time, that gets thicker and stiffer and thicker. And it can create almost like this marble or ball. And you can actually feel it moving around in there if you know someone with trigger finger, that as they bend, this tries to slide in the sheath and it gets stuck in these thickened areas or where the ligaments get crossed. And that can be painful. And then you kind of give a little force and it pops underneath. So you hear this thunk and then it's almost caught and they have to almost lever their finger back up because it can't pull against it. And essentially, that's kind of what we're dealing with when we deal with trigger finger. And so within physical therapy, there's a lot of things that you can do to manage that. And the first one is number one, get pain and inflammation down. That's kind of the main goal of PT anyways. A lot of times this can be painful, make it hard to unscrew a bottle cap or make it hard to manipulate objects, carry things, pick up your kids. So we want to get that pain down. So we got lots of inflammation control techniques, either through cupping or just light massage to kind of bring new circulation, new nutrients in, waste products out, all that sort of stuff. But additionally, we can do things like either electrical stimulation or other options that can get you to a point where it's less painful to use. That's number one. And then number two, we want to think about that fibrotic tendon and how are we going to manage that. So we've got ways that we can help break down kind of thickened tendon or tissue in general. And we use what we call Graston, but you might have heard of ASTEM or IASTM, which stands for Instrument Assisted Soft Tissue Mobilization. All that can help. What it does, it goes in. If you have thickened tissue, it's going to help break down any sort of cross fibers that create that thickness, but it's also going to promote circulation, waste products out, new nutrients in. So we're going to try and get a better healing environment so that when we do have the opportunity to heal that tendon, we're going to have a much better environment around it. It's going to heal faster and more effectively. And then we want to load the tendon because tendons tend to form, that tissue tends to form in the line of pull. And so a lot of times with that fibrotic tissue, rather than line smooth pulling, they end up with a thickness here. And what happens is that when we break that up, we still have that, but it could go right back here if we wanted to. So what we do is we load it so that we train the tendon that, hey, this is where the pull is going, and this is where we need to see this tissue laid down. And so I would say most folks within 4 to 6 weeks have a significant decrease in catching, decrease in pain, and most of them are either well on their way or already on their way to betterness. And so if you guys do have questions about trigger finger, obviously this is kind of that blanket summary here, but if you do have questions, either comment below, message us on most of our social media. I'll see if I can pop up on Instagram. We are at Chandler Physical Therapy, and that kind of stands for most of us as far as where we're at in Facebook, Twitter, we're at Chandler PT and all that sort of stuff. And if you are in the area, you want to get it checked out, if either you or someone has trigger finger or anything else you wonder if PT might get handle on, we do offer free discovery visits. So that's a half an hour. You sit down one-on-one with a therapist just to kind of determine, hey, is this something that is appropriate for me? And if it is, great, here's the game plan that we're going to give you. If it's not, hey, here are the people that you need to talk to get a handle on your condition. So hopefully you guys are doing great on this Wednesday, I guess today is. And if you do have questions, make sure you let us know. We'll talk with you guys soon.